Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel and welcome to Monday's Q&As. This is where I answer your direct and specific questions as long as they can be generalized to the rest of the public. So feel free to email me any questions you may have, info@drzphd.com. If for some reason I can answer your question in Q&A Mondays, I will let you know in email for sure. Other than that, I have selected 6 random questions from Q&A folder based on the orders that they have arrived. As always, I'm keeping everybody's names private for privacy reasons. There's going to be timestamps below for each one of the topics in case if you want to skim through. Having said that, let's get started. I'm excited. I haven't seen this question, so I'm excited to get rolling. Question number 1. Hi, Dr. Z. I'm new to your channel and finding your videos very helpful. I'm 6 feet 1 inch male to female thinking of transitioning. I'm concerned about not passing as a cis female. I've seen YouTube videos on few trans girls that look similar to me and pass very beautifully. However, I still feel like I'm rolling the dice on how I might look. Appearance-wise, I'm like a young Bruce Caitlyn Jenner. I don't want to be unhappy with my transition results. I have been dealing with gender dysphoria since age 7. I'm now in my late 30s, wanting to move forward. Any advice on what to do? Sorry, this got long. It's not long at all. And a lot of people, not just you, are constantly wondering in terms of passing, as I always say, is not something that is essential or matters to everybody else. But I find that the older you are, the more likely passing is going to matter to you. That just somehow tends to fall into those patterns. And passing, as I always say, is also a subjective thing. So your question is kind of, I have advice to your question based on 2 things. One, you're pointing out that you're 6 feet 1 inches, and you already know that there are women and trans women that are that tall and even taller, that their height does not in any way impedes their sense of identity. I've known lots of trans women who were 6 feet and taller, who have no problem whatsoever with passing. So I don't think height is an issue. I think it's a kind of a cultural, just shows you how gender is a cultural construct that we have been led to internalize that women are not meant to be tall, which is absolutely not true. Of course, women are tall, and there's plenty of women tall who are tall. I'm tall myself. I'm 5 feet 11 inches. So I think that's all internalized type of stuff. So I would encourage you not to hyper focus on your height. It's honestly, I have seen people again and again having height not an issue whatsoever. And those of you girls who are listening who are beautiful, tall, what I call Amazonian women, comment below and share as well what your experience has been. Now, my other advice for you apart from height is that I hear this a lot, and this is advice for anybody who wants to step into transition, but is very concerned with passing, very afraid that they will be unhappy with the transition results. What I see again and again is mostly everybody who cares about passing starts out with the same way, where they're concerned that the end result is not going to be the way they imagined it in their head. The reality is that once people do start, they start feeling so much happier as a result of being either dysphoria free or experiencing way less distress, especially the psychological distress. That just experiencing that in of itself becomes enough of benefit to continue forward. And by the time you get to all of those physical attributes and your goals about passing, you'd be surprised to notice how much that has shifted. I'm not saying that passing may not suddenly not matter to you at all. Although I've seen people to whom suddenly it doesn't matter anymore because they're so much healthier and happier. But I think your whole outlook and perception and the way you used to prioritize passing is going to shift and change. I think the goal of transition, in my opinion, always has to be bettering your health, your physical and psychological health. Everything else is secondary. And a lot of times you don't really know how are you going to feel once you experience those benefits unless you actually go through the process? You've been dealing with dysphoria since age 7. That is tremendously long period of time. In my opinion, I feel like you deserve to feel happier, more fulfilling, joyful life. So I really encourage you just to think about all of this, think about all of the things that I have just mentioned. I think the most important goal should be your health first versus so much emphasis on pathing. I know it's hard because nobody wants to experience stigma, nobody wants to experience any kind of um, hateful behavior from assholes in society. But I I just encourage you to think about your health and about yourself. And I promise you, for a lot of people, the perspective on what matters most changes drastically once they experience less dysphoria, once they feel much more happy or more joyful. So that's what I would recommend for you, and I wish you all the best. Question number 2. Hello, Dr. Z. I'm 61 years old. I'm thinking of transitioning. I'm beginning with social transitioning. That's great. Social transitioning or some elements of social are also always very important steps. People a lot of time think that social means without even hormones or feminizing or masculinizing your body, you have to suddenly fully present as a particular gender. And that's not true. It could be something very, very small. I'm thinking of medical transitioning, but I feel that at my age, I just might be too old to volunteer for major surgeries and other things. Do you have any advice? I do have advice. 61 years old is not old. We're living in a world, we're living in a time period where our longevity is longer than it ever has been before. 61 is nothing. It's absolutely nothing. I mean, heck, my husband is going to be 60 years old in February. So it's definitely nothing. Trust me. So I have seen people way older, I've seen people in late 80s go through transition. It's not so much that you're suddenly too old to go through any kind of major surgeries. It becomes more a question of what's your current status of your physical health, what's your overall health, do you have any other secondary health concerns or conditions that may make this process not possible or may make it more challenging. And another question is, will surgeries for you as part of your transition goal help you alleviate dysphoria or not? Remember, surgeries are not mandatory. So I would rather you think and ask yourself all of those things versus allowing a number. Age is just a number. Get in the way. And I bet there's so many viewers who are listening to this who are even older than 61, who have gone through surgical transition, who will chime in and say that they're so glad they went ahead and did it, that it made their life better. So I just want you to be mindful that age is, there's no such thing as too late. It's just more all of those factors, right? Your health, any other secondary, do you have any other health concerns or issues? What is your support system? What is your access to resources? And in what way gender affirming surgery is actually going to help you versus maybe not really bringing much to the table. That's what I would really encourage for you to ask yourself and to look at, but don't look at the age. 61 is nothing. It's nothing. Question number 3. Hello, Dr. Z. Thank you so much for your content. You are so, so welcome. It has helped me a lot. I'm 21 years old. We were jumping now through young adults to older adults, assigned male at birth, and I'm a classical violinist. I'm very worried about my fluctuations in dysphoria and what they mean. Sometimes I have no dysphoria and don't even notice when people perceive me as male and say very gendered comments such as hey bro or hey man, and then sometimes I really don't like it. Okay, so you have a fluctuation in dysphoria where sometimes the pronouns bother you, sometimes you don't really care at all. I guess it also depends on who it is coming from. If it comes from someone I have gender trauma with, like my father, it bothers me. But if it comes from another Gen Z person, my age, I usually don't care. What does it mean if I don't mind being perceived as male from my own generations, but I don't like being perceived as male from other generations? Also, I am confused because Often I feel like a woman or non-binary person, but I feel quite attached to my body as it is. I feel I would grieve if I transitioned. Also, when I was younger, I used to like to express myself in feminine ways, but my dad was like a gender expression police. Oof, I'm so sorry to hear that. Could that have given me gender dysphoria? Because I feel if I was not forced to be a male stereotype as a firstborn son, maybe I wouldn't be dysphoric. Could this be? Also, I mentioned classical violin studies because I'm worried about what transition could mean in such a conservative field. I don't know if it was conservative field among musicians, um, but I guess it kind of can make sense now that I think about it. Whether it be male or to female or male to non-binary, is there any way to microdose hormones in order to take away the dysphoria without altering my body? I'm sorry this question is all over the place. I appreciate you greatly. Your question is not all over the place. I can just see and sense how many questions you have, how you're trying to search for truth, how you're trying to search for understanding. And, being 21 years old and struggling with gender dysphoria, it is incredibly common for young adults, especially if you don't have a very clear onset in childhood that continued throughout into your adulthood. Most young adults will search for it the same way that you do. So I don't want you to feel bad about it, or this is natural, this is normal. This is all part of the process. Where, for example, older adults have struggled with it all their lives. They're not inundated with these questions. Their questions are more focused less on who am I and more on will I pass? Should I go? Is it going to be worth it? Those type of things. So you have a lot of questions here on a table. Let's break them down a little bit. One of your questions was, what does it mean my dysphoria is fluctuating? Why is it when people of my generation, young adults, misgender me, it doesn't bother me, but when my father misgenders me, it really, really bothers me. One of the things for that gap is that you already expressed and shared that you do have a tense history with your dad in relationship to your gender expression. Sounds like you tried to gender bend your expression in childhood and were unable to. Sounds like your dad perhaps sticks to very typical gender norms. And so as a result, that's kind of sits in the back of your head. So when your father misgenders you, all of that past may come up to the surface even unconsciously. And on top of that, majority of us want to be seen and want to be validated by people who are closest to us. That would be our family. So for that reason, having people who are close to us misgender us is going to stink more than having somebody who doesn't know us. I think you probably feel less of an issue when your generation misgenders you because you know that your generation is much more open-minded, much more flexible. If you just notified that person who misgendered you of what your pronouns are, you probably deep down already know that they will be accepting and will be supportive and will have no problem utilizing those pronouns. Versus you that, it's a different issue. So that's just to give you a little bit of an explanation about why you're bothered when your father misgenders you or anybody in your family versus your own generation. Now, you're questioning whether your dad not being able to allow you to explore gender expression may have led to dysphoria. That's like a really nice throwing a wide blanket over things. It's impossible to say. This is something that I would really encourage for you to explore in therapy with a local therapist if you can have an access to them. There's a lot of things here that I would really encourage for you to explore with a therapist in your area to get support, to get clarity. What I'm hearing is a lot of uncertainty about even microdosing. So you want to microdose to alleviate dysphoria, but you don't want to alter your body. You also thinking about transition, but at the same time you respond that you feel neutral or fine with your secondary sex characteristics. There's a lot to explore here because to me, it sounds like there's a lot of room on a table to still finalize what gender means to you individually and where you land on a gender spectrum. It could be that you're gender fluid. It could be that you're just gender non-conforming. It could be that you're non-binary. It could be that you're trans. All of this needs to be explored yet. If I were working you, hormones would be the last thing I would recommend at this point, because I would want you to first have a solidity and a much more rooted sense of self versus the way you are right now at this place. So that's what I would really, really recommend. If you don't have access to a local therapist, start journaling, start writing, start exploring what all of these things mean to you, and just start doing some elements of social exploration. If you weren't allowed to gender bend in childhood, can you start gender bending right now and just see how it makes you feel and what it brings up in you? Can you give yourself that permission? That what I would recommend. I wish you all the best. I think I'm smiling because you're a classical violinist. I love the sound of violin. It's almost like I can hear you playing in the back of my headspace. So I wish you all the best. Hopefully this was helpful. I'm sorry that I can't be even much more helpful to answer your questions, but your questions require some more investigation. Question number 4. Hello, Dr. Z. I know that this might be a repeating question, but it would really help me if you could answer it possibly again. Okay, so I'm not sure if this question was asked before or not, but here we go. I'm at least based on my birthday, 41 of age now. Most of my life, I have questioned myself and felt that something was wrong with me. Me never felt like being me. It was always hard to get to terms with myself because my thoughts going anywhere at light speed due to my ADHD. It took me a long time to accept and speak about me being gay. Just with 21, I was able to accept it. I think English might be, I think you might be from a different country, but still today I'm afraid of leaving it and stuff. Recently, I think a lot more about my real me, and I realized that I totally don't like to think of me being a man. I always assigned the label cis man to me because that is what others supposed me to be, me being gay and cis man. But looking back to me being a child, I realized it never felt like a boy or man. I remember times when I wanted to cut off my penis because it was not right. Oof. But at the same time, I never wanted to think of me as a woman. I realized I always was looking to others, seeing men and women than me. It was always me and all the others that I don't do and did not fit in. But I'm 41. I can be trans non-binary, right? Shouldn't I know it much earlier? So you shared some of the history. You're 41. Sounds like you came out as gay at 21. You have a hard time accepting it. You have a hard time accepting some things about yourself. Sounds like you were thinking about or experienced some element of genital dysphoria with your genitals at a young age. But at the same time, you don't really think of yourself as a woman. So you're struggling to really figure out where you land. I can't be trans non-binary, right? Why not? I don't know, but I think that that's worth exploring. Shouldn't I know it much earlier? Not necessarily. Not everybody knows early on, especially I'm picking up from the way you're writing. I'm assuming English is your second language. You may be residing in a country where all of the things are even less understood, especially when you were younger. So a lot of people have had some feeling early on, perhaps, but they couldn't cognitively really understand what was happening on because there was no language, there was no way of understanding. So what I recommend for you is, again, just like for the person above, see if you can find a local therapist and engage in self-exploration because there's a lot to unearth here. I can be trans non-binary. You might, why not? You might end up that you're trans-binary. You might turn up that so many other things about your gender and your relationship to gender, but you need to allow yourself to explore. I think given the way that you were brought up and where you, at least intuitively, what I'm thinking about is that you never had an opportunity to explore it in a safe environment. So that's what I would really, really recommend. It's reading this, it's impossible to say, yeah, absolutely, you're this or that, because you yourself not even sure, you need to dig deeper within yourself and explore those things. So that's what I would really recommend. Again, I wish I could give you a clear cut answer, but for a lot of people who are in such conundrum with their sense of self, exploration is always going to be the first the key, and exploration is always going to be the first thing that I recommend. So I would recommend that, and I wish you all the best. Question number 5. Miss Natalia, thank you for responding to my request for your newsletter subscription. My question is pretty basic. I'm 54, recently becoming aware that I most probably am transgendered. What I would like to know is this. I spent a lifetime growing comfortable in who I am. I did not know of dysphoria till some months back, but I'd like to know is if you spend a lifetime growing comfortable and you did not know such a thing as dysphoria existed, what are some of the underlying common themes amongst people my age to indicate that the things that this thing, thank you for that this things, I think it's like cut rapidly, seems among people my age to indicate these things. I see. There's no period, so I kept reading. Thank you for your time. I would really love a potential response in any way that you could help. It was appreciated. In that, thank you very much. Great question. So you're 54 years old. You grew up in a time when none of this, there was no language, there was no context to talk about the things. Now looking back, what are some of the things from childhood that could indicate that dysphoria actually existed? This is going to be very, very individualistic based. And the reason I say that because there's no particular pattern to dysphoria. There's no particular ways dysphoria tends to operate. It tends to operate on individual cases by cases. What I can say is that it is, again, very common for older adults to feel like they did not have onset in childhood. But once they become aware and once they start to understand, and especially start to understand the ways gender dysphoria tends to manifest and come up and the way it tends to pop up into your segments of your life, then what happens is that these adults will start looking back in their childhood and suddenly things are starting to they suddenly almost see it because now they're wearing a lens of understanding of what gender dysphoria is. And when they look back, they go, oh, I remember that time when I did this and this. Now in retrospect, I realized I was gender bending, or I did this and this and this. Now in retrospect, I realized I was trying to alleviate gender dysphoria. So in other words, you having a broader understanding and then looking back in your childhood suddenly allows you to piece things together, to see things and to understand them. And that lends to a peace of mind for those people who are concerned that they don't have childhood memories, because chances are a lot of people do experience gender dysphoria. They just don't know that that's exactly what they're experiencing because it's been repressed for so long. So that's why there's no one particular way. There's no particular things to look at. I can't say, oh, if you did this in childhood, that means definitely you had gender dysphoria. Why? Because a lot of us as young children, gender bent in childhood. Almost everybody gender bends one way or another. Little kids cross-pollinate in terms of stereotypical toys in gender roles. Suddenly somebody's playing a mommy role, somebody's playing a daddy role. People do that all the time. And it a lot of times doesn't mean anything. And sometimes it does mean something in terms of people expressing their authenticity. Remember, children, when they're actually really young, they're not inundated with all the stereotypes in a sense of you shouldn't do this and you shouldn't do this because you are this gender assigned birth, and therefore this is prohibitive. Everything is permissible to them. It's adults, they stifle the children's play and prevent further exploration of who they are. So for that reason, I can't really tell you exactly what those things are, but what I can tell you is that very common for people not to have those memories. But then once people do understand gender dysphoria and how it manifests, suddenly they're able to see their past through that lens, and suddenly things start to make sense for them. So if you still don't have good understanding of what gender dysphoria is, read about it, get a bigger understanding. My book On New Terms, when you go even on Amazon, the first 3, I think, or 4 chapters are completely free for preview. And those are the chapters where I outline gender dysphoria, what it is, how it shifts, how it manifests. That gives a really good, robust understanding of what it is. And then look through your childhood, look through that with that lens in mind, and see what things were there and what things were not there. That what I would really recommend. And I wish you all the best. Hopefully this is helpful. Final question for today, question number 6. I'm looking at because sometimes I make this Q&As so long, and I know that nobody has 45 minutes to an hour to hear certain things. So I'm trying to keep them concise and really punch into the point and try to keep them about 20 minutes or so. And yeah, I think that would be helpful to all of us. Good day, Dr. Z. I must say, finding your channel has been of great help, and it has helped me revise my take on transgenderism. I gotta say, I don't really like the term transgenderism. Anything that ends with ism is not good for me. For the best for every subject you have touched on, but I get it. I'm glad that you have broadened your understanding on gender dysphoria and how it all the facets of it. This last December, I confirmed I am trans woman after 6 months of gender envy going through the roof. Presenting and taking the role of a male has caused me pain and discomfort for as long as I can remember. I'm currently 19, studying while closeted to my family and with a very small, albeit supportive social circle. Well, I'm glad to hear you have a social circle. With 7 months of ongoing non-medical transitioning, I have now noticed a dangerous behavior pattern I'd like to ask you about. With every step I take towards an identity, I feel fitting. I can't help but stumble back into disappointment and dragging myself out of recognition by creating more and more endeavors every time I get rid of one. Oh, I have no feminine clothing. Now, I don't have enough, or it doesn't fit me good enough. I do no makeup. My hair's too short. My makeup's not good enough. I need to voice practice. I'm too embarrassed to speak like that. My hair is too short. It's actually the same length as yours, and it's not styled. Such a great length. Point is, I'm constantly dragging myself down, and I never feel like a valid person, much less a woman at that. I know I have worked for myself more than ever before. Every advancement has actually given me euphoria and hope, but I just can't allow myself to accept this as progress when losing all patience. Now that I've realized this, I feel tremendously confused and like giving up on transitioning. Why is this? Is there something I could be doing wrong? You're not doing anything wrong. What I'm hearing is I hear two things. I hear resistance, and I hear resistance, and who knows why you may have resistance. You may have resistance because you're afraid to move forward. And whatever your fear is, it's for you to dig deep and figure out. Your fear could be you're afraid you might make a mistake. Your fear could be you're afraid this is not who you are. Your fear could be that if your parents found out, it would be a problem. Your fear could be actually moving forward and fully embracing your transition. Your fear could be multitude of things, and that's for you to sit with and to figure out and to understand what they're telling you. Resistance often arises out of fear. All of the things, oh, I have no feminine clothing. Now I don't have enough of it, or it doesn't fit me good enough. I do no makeup. My hair is too short. All of these are resistance statements camouflage as self-sabotage. When we tell ourselves all the things that are based on I can't, I shouldn't, I can't, I shouldn't, I can't, I shouldn't, that's an indication that we're holding ourselves back. The question is, why are you holding yourself back? Because these are all the things, everything you just said here, all of this can be worked through. Everything you're saying here, you already know is not true. You already mentioned that even though you say your hair is not long enough, it actually is. It's exactly the same, like you said, it's the same length as mine, which, by the way, that's a long hair. I mean, it's a short haircut, but this is long hair. So sounds like you're telling yourself the things to prevent yourself from moving forward. The question I have for you, why are you doing all of the things? And that's what you need to figure out. You need to either see a local therapist. I'm sorry, I'm sure that a lot of you are annoyed with me recommending local therapists, but it's, that's what therapy is there for, is to help you figure this out. Um, and for you to dig deep into your fears. Why are you self-sabotaging yourself? Because all of the things you said, I bet if you were to sit down with all of the statements, you would realize that they are not true, or either they're just within your reach of modifying. So that's what I would really encourage, because all of this, again, everything here, to me, this is what I hear from clients who are very resistant, and they're creating the statements as a form of self-sabotage. And we all engage in the thing one way or another. For you, in regards to gender, that's how it's going to manifest. I engage in my own resistance in regards to a lot of things. So it's important to recognize when we're engaging in I can't, I shouldn't statements, and pay attention to them, because chances are those are our ego's tactics at self-sabotage, at keeping us from moving forward. So that's what I would really recommend. I bet this resonates with a lot of viewers. I bet a lot of you are telling yourself the things. I shouldn't do this because I'm not going to pass. I'm too tall. I'm not pretty enough. I don't know how to do makeup. Well, guess what? Nobody knows how to do makeup. Trust me, not a single person is born knowing how to do makeup. And if you think that, if you think my makeup is fantastic and you think that I just knew intuitively how to do it, I still struggle every day with eyeliner, lots of Q-tips. Let's just say I have boxes and boxes of Q-tips. So some of the things is you're not supposed to be good at. You're supposed to learn as you go. It's supposed to be a process. So be careful not to fall into the trap. So that's what I would recommend. Investigate your resistance, investigate your self-sabotage, investigate and see what your fear is telling you about yourself and your relationship to your gender. Great questions today for Q&A. Chime below, share with others your input, your thoughts. And if you do have questions for me, feel free to email them, info@drzphd.com. Hopefully this was helpful to everybody, and I will see you all next time. Bye.